right, so I have an LLA here, and it is 3D printed. This is the model. So the first thing we're gonna do is try it on the patient, make sure everything fits very comfortably on there.
Can you explain the difference between a 3D printed and the Herbst and the Mara, where you see the bands?
You got it. So the difference is, if you look at it, it does not have a band that goes all the way around the tooth. This is actually custom carved to the tooth itself. So it sits inside the occlusal surface and hugs the tooth very, very tightly. This is actually more of a bonded retention than a banded retention. So it's a little bit more custom to the tooth.
Do you need separators with the 3D printed appliances?
We do not need separators for the 3D printed. So they just slide right on there. So we just want to make sure that when we slide it on there that everything is fitting appropriately on the tooth. Then we're going to take it out. To prepare the teeth, we are going to use our pumice, and as you can see on here, for the 3D printed, they're going over part of the occlusal surface too. So we want to pumice everywhere that you can see the bands on there. So we're going to pumice all the way around, including those occlusal surfaces on there, all the way around. And we're going to take our water and our air, and we're just going to wash all the pumice off, make sure it's nice and clean. Then I'm going to take some cotton, and I'm going to put it both on the cheek side and the lingual side to make sure everything's nice and dry. Most of the time you kind of have to hold the cotton right here underneath the patient's tongue, otherwise it's going to come right back up and get everything nice and wet. You are going to take your air and you're going to dry off all the surfaces so they're nice and dry. Then we want to etch, and you're going to place your etch everywhere that you saw those bands. So you're going to go a little bit on the occlusal. So you're going to go all the way around everywhere that you saw the bands there. We just need a nice coat on there. And then we're going to leave that for 30 seconds.
You're going to do both sides.
Yep,
right?
absolutely.
We're showing one, but you do both.
Both sides. You leave it for 30 seconds, and then you are going to wash that off with your air and your water. Nice good rinse. And then we're going to get that nice and dry until you see it chalky white on the tooth. Then you're going to take your Assure, and you're going to take it and you're going to rub it into everywhere that you saw that band sitting. So a little bit on the occlusal surface, all the way around. You want to really get it in there, just kind of work it in. A little bit harder, you want to kind of scrub it into place. So after we have everything very nice and dry, we're going to take our Assure, and we are going to assure the appliance. We're going to make sure it's nice and covered in there. It should all look very shiny. We're going to take our air and just air it out so that you no longer see the Assure flowing around there. Then we're going to take our band lock, a very thin layer all around. It is custom fit to the tooth, so you really do not need much at all. And it's going to go where it needs to for coverage in there. So just kind of get it everywhere in there. We're going to take it, we're going to place it into place. And then we're going to have the patient bite down on a bite stick on there. So it's going to push down nice and tight. You'll see it kind of flow everywhere. I like to just take and wipe it away. Now with these, you can end up with band lock kind of stuck around. So I like to take my micro brush in there and really just get around the appliance. You'll see it comes underneath this lingual edge a lot, the buccal edge. I just want to make sure everything is nice and clean before you shine your light on there. You'll see the blue all around the edges. We want to see that because then we know that band is nice and sealed. However, we don't want to cover the occlusal surface. So just make sure there's a little edge of the blue all around. Kind of clean it up just a little bit. Everything will be nice and sealed.
Now, if you have a lot of band lock that squishes out of there, what would you use to clean it up?
I would use a cotton roll, or actually my finger works really, really well because the glove kind of grabs it. But either way, you kind of use that cotton in there, kind of pull it away. And then you are going to light it. And I do light from the occlusal. And I go like 3 beeps.
How many seconds do you do?
I'm gonna do, it's 9 seconds on the occlusal. I'm gonna go to the lingual, and I'm gonna do another 9. I'm gonna go to the buckle, I'm gonna do another 9. And then for these, because band lock is dual cure, so it cures with the light, but it also cures over time, I have them bite on a piece of cotton roll, and I'll just have them hold down for about 30 seconds or so. After they've given me like a firm bite for about 30 seconds, I'll take that out and I'll tug a little bit just to make sure the appliance is nice and seated and not coming out of there.